Good afternoon, everyone, and welcome to the first webinar of the season. I'm Gail Cormier, and I am the project director for NASTAC, the Family Center of Excellence. We will be discussing partnerships between families and school personnel, and the title of our session today, and this is the first one of the season, is Family Engagement in School Mental Health. Before we start our jam-packed presentation today, I would like to go over a few housekeeping items. Today's webinar is being recorded. The recording, along with the PowerPoint presentation and slides and any additional resources, will be uploaded on our events page after the presentation. All attendees will be muted for the presentation portion of today's webinar. However, we still look forward to hearing your questions, and we're happy to help you with any technical issues. If you have a technical issue, either raise your hand with the little emotion con and we'll get someone there, or put it in the chat box. We will have staff looking at the chat box to either answer any questions you may have or to help you. If time allows, we will unmute and you will have an opportunity to ask questions. You can always raise your hand and use the raise your hand button. When you leave this webinar, you will be redirected to complete a short feedback survey using the link provided. This survey will help us continuously improve our webinar, and it also fulfills our SAMHSA funding obligation to provide them with important data required by our contract. Please note, all information will be confidential and we will respect your privacy. We do not offer CEU credits for our webinars, but you will receive a certificate of attendance immediately after you fill out the survey. I would like to thank SAMHSA for allowing us to share this information with you today. And again, thank you for joining us. And as you see on our slides right now, we have what we call our NASTAC family-centered language. NASTAC always uses family-centered language, and we encourage all of you to do too. We try to make sure we're trauma responsive, strengths-based. We avoid blaming caregivers. We want to be inclusive, person first, respectful, non-judgmental, and consistent with our actions. It is now my honor to turn this webinar over to today's panel of presenters. I will let them introduce themselves. Michelle?
Good afternoon, everyone. Welcome to our webinar. I am Lachelle Freeman, and I am a project manager, at NASTAC, which is our National Family Support Technical Assistance Center under the National Federation of Families. So what I'm going to start off with is I'm just going to give you guys the parent perspective of having a child with special education needs and assistance, and how I had worked with my son in order to create engagement with leaders in the lessons that I've learned as I worked in this field. So first, I want to introduce you guys to Joshua Freeman. Joshua entered this world April 3rd, 2020, 2000, I can't even say it, 01. He was born at 25 weeks, and he was only 1 pound, 10 ounces when he was born. So let's talk about Joshua's early school days. One thing that we did with Joshua was we put him into pre-kindergarten pretty early. Just wanted to make sure that he was able to get some structure and some guidance and start getting into a routine of being in school and interacting with other other children and adults. So when he was in pre-kindergarten, he had a lot of behavioral concerns and problems. He was a little bit intrusive. He didn't watch his boundaries. He talked and he kind of clowned around a lot. So one day, the teacher said they wanted to have a parent-teacher meeting. And I was thinking, oh my God, what has this child done? So we went to the meeting, and I had really thought a lot about what I was going to say in this meeting and what were they going to say about my child. And so before the meeting started, I said to the teachers, you know what, this is my child, and I'm probably going to be a little defensive or offended possibly about something you might say. So if you can kind of show me some type of grace, that would be great. And we could figure out how we can really partner with each other in my child's education. And this is still pre-K. With my child's education, so we could be a team and he can have the best opportunity that we could have. And me saying that actually eased my anxiety. And I believe that the teachers talked to me differently about Joshua's behavioral problems. But it also clicked in me that at that time I was actually I did school-based mental health, and I felt terrible because I said I must have interacted with some parents just following suit, just going about my business as usual. You know, you have these 45-minute increments, and thought, oh my gosh, how many times have I talked to parents the way that I did not want to be talked to with my child, and thinking that I was being very engaging, but not so much. So this is the second picture that you see is Joshua. We moved to Maryland, and he, you know, got a chance to write his own book on a hero, and he did Nelson Mandela. The third picture on the slide you see is Joshua actually winning an award. We lived in Howard County, and Joshua had gotten one of the highest math scores in the county on the standardized test, and he was honored by the elders of Howard County. So we were very proud of him. So I want to talk about, we've lived in 3 different states, and I want to talk to you guys about how the different states maneuvered and handled the educational needs that my son needed. So with my son, as I said, his math, there was no problem with math, but he had difficulty with reading comprehension. He had a really hard time getting what was in his head on paper. Even to the point when he was in elementary school, if he wrote a sentence, all the letters would be together. So he would literally have to write a word, put his pinky in between it, write the next word. So he had a lot of problems with just spatial things and getting his thoughts out of his head and onto paper. So when we were in Pennsylvania, Joshua went to 2 schools. The first 2 years were at Dilworth, where he did the pre-kindergarten. And then we had him placed in he went to a small science academy. So because it was a small classroom, they had concerns about him being what they would say a class clown, joking, doing anything to distract himself from doing his work. But they had the class size small enough that they were able to cater to him, and he was able to get his assignments done. Next, we moved to Maryland. And when we got to Maryland, I was really concerned because homework was taking a long time. Joshua was frustrated with schoolwork and things like that. And I said, what can we do to help him? So my undergraduate roommate was a early education reading teacher. One thing she told us to do was put the captions on our TV. It forces him to read while he's watching TV. The other thing she said was get him tested for an IEP. And whatever that school is willing to give him, load him down with those services until he gets to middle school, because if he gets behind in elementary school, it's going to be a terrible time trying to catch up. So when we were in Maryland, when he took the test for the IEP, he missed being placed in being able to get an individualized educational plan. I'm sorry, I'm saying IEP, but it's an individualized education plan, and some people I think maybe call it a 504. So he missed the mark by 3 to 5 points. But in Maryland, they said, you know what? He's on the borderline enough that we're going to give him the supportive services and the accommodations that you need. So they did that for him right in the class with hands-on support, tutoring, additional time for test taking and things along those lines. And he did really well in that system. The next move was we moved to North Carolina. And when we got to North Carolina, his first year there, he was in public school. And we asked them, would they, he has said he has an individualized education plan from Maryland. Can we use that plan? And North Carolina said, no, we want to retest him. So we said, okay, well, let's retest him. Again, he took the test and he missed the mark by, 3 to 5 points. In North Carolina, they said he does not qualify. He's too high functioning. He's not, he doesn't qualify for any accommodations or supportive services. And so I, of course, went back to the drawing board thinking that, no, I know my child needs these services. So I requested to have a meeting. And the only reason that we were able to get, well, the only reason that we got those accommodations were because they made an error on his evaluation. As I was reading his evaluation, it looks like they had cut and pasted another child's information in there. But the fact was I knew at that point that I had to advocate for my son, to get him the services that he needed. So when he went to the middle school, he actually had some behavioral problems. And so we decided to pull him out and put him into a more structured situation. So we sent him to Gaston Christian School, which was another private school. And while there, we wanted to transition his accommodations to the private school. So the public school said, you know what? The only way we could give him these accommodations is if for 2 classes, he comes to our school during the middle of his school day to get those accommodations, and then he goes back. Of course, that's your school day is wasted, and that's not working well. I was able to work with the counselors there and just basically say, can we copy and duplicate everything that they were doing for Josh at the other school? And they were able to do it. Again, Joshua, very much distracted, very, class clown. And I hate to say class clown, but that's just the language that was used. But he was being silly, and he was really just, at some points when it was math, he was bored, and other points he was trying to avoid doing the work, even with his support that was in place. So he got that support in Gaston Christian. He stayed in Gaston Christian until the 11th grade, where he got into some behavioral problems again, and he went back to public school. When we get to public school, because his curriculum was so advanced at the private school, they literally put him in smaller classes in high school. Me and his father kind of looked at each other like, really? And so he breezed through 11th and 12th grade with no problems. So one thing that we always tried to do with Josh is we tried to expose him to leadership courses, going to leadership camps, spending summer camps at different places to, broaden his horizon and see, help him figure out what he really wants to do. And so, as you can see in the picture, we were happy that this child graduated from high school. And he said, he wanted to go to college. Even though we had talked about college throughout his upbringing, we really wanted to give him an opportunity to find his path, and said, it doesn't have to be college for you. If it's a trade you want, go for that. Figure out what it is you want, because it is your life that you have to live. So Joshua, since he graduated from high school, has enrolled into 3 different colleges. So the first one he went to was a small school in Pennsylvania, Washington and Jefferson College. He went there, he walked on to the football team, and he had the accommodation. We met with the accommodation counselor, and one thing that they always encouraged the children were that you are 18 years old, your parents don't have to participate. You can sign, you don't have to let them have access to your information. But it was something that they really said it multiple times. And Josh was kind of like, no, I want my parents here. I want them involved. That's fine. I'll sign the papers. And we were able to help, request what he needed for his classes. The other thing is within college was that when you have those accommodations, you actually have to take those accommodations to each class that you need those accommodations in, give them to the teacher, and work out what your plan of action is. And one thing that Josh experienced was that, yes, it was more work for that teacher, and he felt that pushback. And so he felt like he was bothering them, that he was asking for something extra. Maybe he really didn't need it, And so Joshua kind of withdrew a lot with the response that he got from some of his professors. And there would be things like, if he's supposed to have no time tests, and his teacher will give him an additional 30 minutes. And Josh was like, well, she gave me an additional 30 minutes. I'm like, it says no time. You could take it at a different time, but there's no time on the test. And so we would try to just teach Josh to advocate for himself. When it's not, it doesn't say what it says, you got to do it. But Josh really struggled with, he really struggled with holding people to the standards of what they were supposed to give to him. And I'm gonna speed up because I feel like I'm behind time. Joshua also enrolled into Pembroke University, USC Pembroke, and currently Joshua is enrolled in Johnson C. Smith University in Charlotte, North Carolina. So again, with the accommodations, he struggled to hold the teachers accountable to that. So I have to jump back to his first year out of college. So his first year out of college, Joshua had a traumatic car accident. So I'm going to show you guys, just forewarning you, I'm going to show you a picture of the car that God graced him to survive out of. And he was able to recover. So you guys know everybody went through the pandemic, and Joshua, I thought I was bringing him home for spring break, and he ended up home finishing school online. Then he was working, then he got into a car accident, and then he had to recover from that. After that head injury, Joshua was definitely a different child. His response time is a little bit slower. He was having a lot of effects from COVID, effects from isolation. A lot of things were happening, but I'm happy to say that he's enrolled into Johnson C. Smith. He's only a sophomore because of the process of dropping classes, adding classes, not finishing classes, all of those things, but he's still adamant that he wants to have a 4-year degree. And what I'm learning is to give him space. And at the age of 22, for him to make decisions like your whole life, we have advocated for you, showed you what you have access to. But now at this age, you really have to advocate for yourself. One comment I want to make about the accommodation offices. 2 of the schools that I went to for the accommodation offices, I was trying to figure out, why is it always in the basement of the building? You have to like search for them, and they're always on the bottom floor. So thinking about family engagement, that it doesn't feel great to go to the basement to talk to people about accommodations. But his current person that he has the accommodations with, she said, I don't care if things are going well or if things are going bad. You check in with me every week to make sure that your classes are going great. And this is my second to last slide. The biggest thing is I'm glad that I do have that relationship with Josh to help him advocate. It's hard as a mom for me to pull away and let him make those decisions that he has to make in terms of his school, his life choices, and things like that. This picture where I have my teeth gritted, it just shows that day when we were out registering him for classes and going through all his meetings and stuff like that. But I wouldn't change it. He's a blessing. And last but not least, I always say what we're doing here is renting these children and hoping that we do the best to help them engage with the systems they're involved in. And for me, I need coffee first. So I'm going to turn it over to Dana. Thanks.
Thank you so much, Lachelle, for sharing your story. I'm here to share the perspective of the teacher and to start to tell you about how deep that love has been. I was actually dreaming of being a teacher from the first day I went to school and even before that. So this picture, me on the right, this is my first day of kindergarten. And in elementary school, I went to visit an elementary school and other places and immediately was drawn to, I want to be a teacher. And when I went in junior high to be able to choose a site to visit for career day, I chose an elementary school. And as soon as I could sign up for a practicum in high school, I did. And I just loved being in the classroom from that moment on. I got an elementary education degree in college and started teaching preschool while I was in college in Missouri and then again in Georgia. I went to Japan right after college and taught high schoolers, toddlers, middle schoolers, everything in between. And I went back to get a master's in educational psychology because I really wanted to teach the gifted kids. I had been a gifted kid with a lot of mental health challenges, and I wanted to be able to work with those children. But my first year in the classroom, I actually found myself in a special education inclusion class in Georgia and teaching second grade. And I had most of the class by myself, but I also had a wonderful special ed teacher who would come in for about 2 hours during the day. And a lot of the children that I taught in that classroom also had mental health challenges. I had a lot of children who had experienced some extreme poverty, and their families had been affected by gun violence. Many of my children had parents who were incarcerated. I had several students who were living with grandparents and other family members. There was just a lot of different things that the children were bringing into my classroom every day. And I was absolutely not prepared to be able to compassionately respond to a child who is having hallucinations and crawling under a desk and screaming while I am a first year teacher standing up there by the whiteboard, having no tools in my toolkit to be able to respond to this in a way that's going to be helpful to that individual student and the rest of my class. But I did decide to leave the public school system because I thought, well, this is just the public school system. This charter school that's telling me they're offering a world-class education and they are using the latest research to really support student social emotional learning. This school has got to get it right. So I moved to New York City and became a kindergarten teacher in Brooklyn, my dream, everything I had ever wanted. And I saw just as many challenges. And Lachelle, if you could move to the next slide, that'd be great. So I started my teaching career with this intense optimism, like I am going to change these young minds and therefore they will go out and change the world. And very quickly, as I had my one single behavior management class to take me into the classroom and try to figure out how I was going to really support 20 different students who are having 20 different behavioral experiences at once, I experienced a lot of frustration. And of course, I went to my colleagues and my supervisors, and there were trainings that we did. There was some support from the counselors, but in the elementary school in Georgia, the counselor was doing so many meetings for IEPs and doing the general school social emotional learning that has to take place, that there wasn't a lot of time for one-on-one counseling. And once I got to the charter school, I could refer my students to the psychologist, but she was only there 2 days out of the week. So if she wasn't there and one of my children had a crisis, I didn't know exactly what to do. And the days that she was there, she was mostly testing children for various things. So there wasn't a lot of support. There wasn't a lot of support about mental health in the training. There were things around behavior management and social emotional learning, but I didn't ever in my years of teaching back in the early, back up until like 2015, I never received anything about mental health symptoms or what to do. I know that the landscape has gotten so much better, but without having any of that knowledge, I had a lot of fear about how to respond when a child was going through a crisis. And eventually that led to feeling extremely overwhelmed as a teacher. I was trying to juggle meeting with parents, coming up with lessons, and trying to support students, but I just didn't have the resources or the connections to other people that would have helped me help my students. So that eventually led to just feeling a little bit despondent that I didn't know what to do. And the burnout got so big that after my second year of teaching, I decided to leave the field. So now you can go to that next slide, Lachelle. And one thing when I was looking back at my materials from when I was a teacher that really broke my heart is all of the positive notes that you get from your students. And that's why most of us teachers do it. We want to make a really personal impact on children. And the screenshot I have there of the note I received on the left came from one of my students. And I in the moment, what must have been so impacted by just this one line where she says, "You don't hit us." And that is just a reality that sometimes when you are teaching, you learn about these aspects of children's lives that you then have these mandated reporter obligations that you have to do, but that might be the last time you're involved in that situation, and you don't really know how to support the student in the classroom who's going through these mental health and trauma situations. So I decided to leave the teaching field, and that picture on the right is my last day of teaching, when I received a few bouquets of flowers from the students. I really loved being a teacher, and I got so many parents who said, "Why are you leaving? Just another good teacher leaving the field." But I thought I could go back to school and get a developmental psychology degree and make some differences in education policy, go to New York and do some research. Next slide, Lachelle. But after grad school, I realized that my true calling was really training and technical assistance around mental health. And I started with the MHTTC, the Mental Health Technology Transfer Center, on their school mental health team. And I wanted to really take research, which does have some really great things to teach us about what works for most students, what works for most teachers who are trying to be not that mental health professional who is addressing specific diagnoses or finding treatment and specific evidence-based practices that are going to help an individual student, but a teacher who's juggling a whole classroom of students with different needs and different desires. So I really put my passion into turning research into digestible and practical strategies that schools can use to support students who have experienced trauma or who have mental health challenges. And through the MHTTC, one of my favorite projects was the Compassionate Conversation project. So what we did is we brought together school leaders. Lots of them were mental health professionals, others were administrators. We brought them together during COVID-19, when they were feeling really burned out and overwhelmed. And we had an hour with them, and we started with just a brief mindfulness practice to get them to release a little stress and come into the room together. And then for 10 minutes, I just went through a little tip sheet where I gave very, very practical strategies to address the topic that we were talking about that day. And you can see a screenshot of the tip sheet there. And I would try to give different levels, because what we know is schools are all at a different place on this journey. Some of them have huge school mental health teams that can respond nimbly to both the individual mental health needs and the school culture that can impact the mental health of the entire school and staff and students. So after giving some strategies that were kind of tiered and geared towards families, geared towards staff, geared towards leadership, geared towards students, then and we would record just that first 15 minutes as a resource. And Gina's going to pop a link to the video for fostering connections in there, so you can look at that later. And then we would turn the camera off so that we could have an open and honest conversation. And we would spend about 15 minutes doing reflective questions, and then talking about challenges, and then talking about solutions and successes. And I would add to that tip sheet so that it was co-created with the school administrators and leaders that were in the room with us. And that series went so well that we decided to do a family version of it as well. And we got to hear straight from the families and people who work with families about what was working for them. And that was a really valuable resource, because again, it wasn't just people who are in ivory towers doing research telling us what should be done. It was really created by the folks that are actually doing this work every single day. Michelle, you can go to the next slide. So when I moved over here to NAFSTAC and the National Federation, I was so excited to kind of merge these two passions of mine, like family engagement and partnership, alongside school mental health. So we worked with MHTTC and the National Center for School Mental Health to create this toolkit that we will share with you in the follow-up email about family engagement. And it really helps bring in the idea of family peer specialists. So family peer specialists have this really unique role. They're able to offer peer support to family members who have children or other family members who have mental health challenges. They also mentor them to become confident advocates for a family-driven system and the desired supports of their children, not just allowing schools to tell them what they're going to do, but to co-create that plan together. Family peer specialists also help families navigate multiple systems, sharing their experience perhaps with the juvenile justice system, perhaps with housing, just trying to help them get their feet on the path towards having coordinated care for their child. And then another thing that family peer specialists do is that they teach specific skills to the family so that they can improve their own well-being and the well-being of the family. So that might be some self-care skills, because we know that when we're supporting a family member who has a mental health challenge, that can be really exhausting and take a lot of energy. So it can be important to help family members understand how to take care of themselves as well as their families. And you can learn more about how schools can move from engaging families to really partnering with families in that toolkit we'll share. In the next slide, I just wanted to share this quote from a family member who received services from a family peer specialist. I would really appreciate more of a breakdown specifically of our area in Northwest Georgia. These are the programs. These are the acronyms. I want a breakdown of the day-to-day. These are the people, and these are the roles. You can tell me you're a manager of whatever title, but I don't understand what that means. That's not telling me what your job is. I understand what family peer specialist Miss Hope and Angela's duties are. I've seen evidence of what they do, but there's still things I'm learning every time we interact. Everything is so vast, and it's like a never-ending story because there's so many things going on. Don't hand me a pamphlet about ADHD. We can get ADHD information everywhere. I need to know what is right here, right now that I have access to. I want to know about the therapy group, which I wouldn't have known about if it wasn't for Angela. Having those parent groups has been a tremendous help. I wouldn't have known that if we didn't get referred to this program. I wouldn't have known that had the school not finally had somebody in there saying, hey, look, this is available to you. So it's really important that schools partner with organizations who have people like family peer specialists there to guide families in navigating these various systems. I have one more slide. One great project that I was able to work with through the New England MHTTC and SAMHSA is the Heart Collective. And Gina's put the website there in the chat. And this was a really great project that centered the student, and you can see that there in the graphic at the top left, where the child is within this circle where we have home, community, schools, and systems all working together for these 4 key things: to reduce the causes of trauma, to support youth in overcoming the effects of trauma, to build resiliency against future trauma, and to develop protective factors so that new traumas that come up don't have as great of an impact. That's the compassionate school mental health model that we refined through a committee of healthcare workers and educators addressing and reducing trauma. And we created this website, the Heart Collective, to really give schools and mental health centers and healthcare centers tools to be able to effectively collaborate, to really get together around this, the youth, to support them. And one of the things that emerged out of that collaboration was this tip sheet, tips for advocating for school mental health needs. So Gina's going to put that in the chat as well. And that has some really great steps for how parents can actually advocate for the desired supports for their own children. And I have a lot of faith that we're going in the right direction with more of these fabulous collaborations taking place. And now I want to pass it over to Samantha to talk about the great work that the National Center for School Mental Health does.
Good afternoon, everybody. I'm Sam Reeves. I am an assistant professor over at the National Center for School Mental Health, and I'm excited to be working with this great group here today and talk about this really important topic around family engagement. At our center, we use the definition from Dr. Linda Gargan at the National Federations of Families. And we love how it highlights the importance of collaboration and shared responsibilities. It's more than about involvement, but about relationship building and a partnership between schools and families that helps build a safe and supportive environment for the whole school community and working towards enhancing student and family outcomes. And next slide. So we at the center work around school mental health and comprehensive school mental health systems. So we're in this unique kind of area between this intersection of education and mental health. And there's tons of literature and best practices and evidence-based strategies for how schools can partner with caregivers and families around education, including, involving families in shared decision making, really making sure that we value families as partners and leaders, and that includes doing the work to build capacity and to make them feel like meaningful members of the team and have the information they need to participate in meetings around mental health and education. It also really focuses on this bi-directional way of communicating, that it's not only the school kind of directing interactions with the family, but that this is working both ways, that parents and school personnel feel like equals in their relationship and in their ability to communicate with each other in a positive, proactive way to support students. And we've learned that being culturally responsive and really tailoring how we use our engagement strategies and expectations around what that is aligned with our communities. And different communities can have different different ideas on what full engagement looks like. So it's always important for parents and schools to have these conversations around what the expectation is for family engagement. So there's best practices that exist in education. And if you go to the next slide, there's also a fair amount of literature and recommendations around how clinicians can engage families in mental health by providing psychoeducation and really trying to explain and to understand how families conceptualize what's going on with their kiddo. Accessibility, having flexibility in when sessions happen, how families can be involved in sessions, being able to understand the family view on mental health, and again, making sure that those interventions are culturally responsive are some of those recommendations that have come out of the mental health literature. And if you go to the next slide, we in school mental health are kind of in this unique in-between area. So there's lots of research and suggestions around how to engage families in education. And there's some resources and best practices on how to engage families in mental health. But comprehensive school mental health systems sit within an education system, but they're tiered approaches. So not everything is individualized treatment, and really focusing on those things like Lachelle was describing on how she was really able to support her son around advocacy and advocating for himself and collaborating and showing up to meetings to support him in his needs to be successful at school. So there's that level, and then we also have our small groups and our SEL. So we really try to figure out a way to create a assessment tool that could be helpful for schools and for families to assess how we're doing specifically around our comprehensive school mental health systems. And to develop this measure, which will be up on our SHAPE system, some of you may be familiar with our SHAPE system. It is our school health assessment and performance evaluation system. It currently includes our mental health measures, like our school mental health quality assessment, which really assists schools in rating themselves against best practices. But we believe that family engagement and being culture responsive are also really key ingredients to having a safe and supportive school. So we're trying to expand our reach to provide additional tools around some of those big topics. So this measure will go up there, and we reached out to some of our partners at Fredla to release a survey and disseminate a survey for us so that we could get some feedback from caregivers on, how would you want to be involved in your school mental health system? What does that look like for you? What kind of activities do you want to participate in or wish that you were participating in? So we were able to reach out to caregivers to try to get their perspective on what does this really look like. We also shared it with our school-based mental health clinicians that are work here at our school mental health program and support students here in Baltimore. So we were able to get some on-the-ground perspective on what this kind of looks like, to take those things like Dana was saying, to take the things we had in research and make them really actionable and really livable. So that's some of the information on the development of the tool. And we wanted to make it short. So it only takes about 15 to 20 minutes. And there's some information provided on how to support action planning and to think about how we work towards improving our use of best practices for engaging families. So on these next few slides, I am going to walk you through some of those key indicators that we have developed for this tool. And if you have a paper and a pencil out, you can kind of go along with me and give your score or give your school a rating, and just to think about whether or not these seem accurate to your experience. This is not up yet on our site, so we are, always open to feedback. So if you've got anything that really jumps out at you as to what this may be missing, you can always feel free to drop that in the chat box, where we're always open to feedback. But before we get into the individual measures, I just wanted to remind folks of what I mean by comprehensive school mental health systems. So at schools, we really are thinking about a full array of services and supports for students. This goes from our mental health promotion activities like social emotional learning, teacher wellness, school climate, positive behavioral support interventions, those things that are good for everyone, all the way down to our individualized mental health interventions that are often led by, our school social workers, to be able to provide those really individualized supports for students who are experiencing significant impairments. So it spans the spectrum from promotion to treatment. And more importantly, it's really built upon a strong foundation of district and school professionals, including our families and including our school personnel, on how we're going to partner to create these systems, to provide these interventions. So it's not just about those kind of forward-facing things, but also how we work together, how are we keeping track, how do we become a strong team here. Next slide. And we have kind of broken this down into 7 domains of what makes up a high quality school mental health system. And this goes from who's on our team and how we work together in our teaming domain, to how we are aligning our interventions for students and families with their strengths and their needs. Mental health promotion, again, is our tier 1. Early intervention and treatment services and supports are our tier 2 and tier 3. So this is when we are increasing the amount of supports we have, dependent on the student's needs. So our tier 2 would be a little more support, maybe some small groups, some focus around maybe social skills or a particular challenge, whereas tier 3 is those really individualized supports for students. And it also includes screening, which makes sure that we are kind of keeping an eye on and have a good picture of who needs what in our school population. And funding and sustainability is how are we going to pay for all of these things and how are we going to sustain it once, grant money ends or a program goes away. So that's a key component as well, as is impact, which is a documentation of our efforts. So the reason I mention those is because this is where we kind of started and figured out how we can incorporate, how we're making sure we are incorporating caregivers into each of those 7 domains and what that work kind of looks like. Next slide. Okay. So I am going to work through some of our items. We have created 2 domains for family engagement. So this first domain is really geared at how are schools engaging caregivers? What of these strategies and how often are they using these strategies? And they are able to rate themselves on a 1 to 6 scale, from we never do this thing to we always do this thing when there is an opportunity to do so. So, and you would rate, and they would be able to rate themselves on each of these items on a 1 to 6 scale. So every one of those little colored blocks. So these first ones are around sharing information. So does your school provide information about different ways that caregivers can be engaged in school mental health? And they would be able to rate themselves on a 1 to 6 scale, and whether or not, how frequently they are doing these things. How often are we inviting caregivers to participate in school mental health teams related to planning and implementation? Are we holding meetings at days, times, and locations that are accessible for parents to attend? Do we provide alternative options for parents to be engaged in decision-making if they cannot attend meetings? Are we assessing caregiver perspectives and priorities related to student mental health, strengths, needs, and services? And are we inviting families to learn about and inform mental health screening policies and procedures? So these first group of questions really align with three of those 7 domains that I mentioned. So teaming is who's on our team, how are we working together? And as you can see, some of these items are related to that, right? Are we holding accessible meetings? Are we providing alternatives to those who can't join those meetings to still have a voice and feel like they participate? Are we sharing information? Are we making sure that we're gathering their caregivers' perspectives on what we're doing? And are we aligning things with the needs of the school? So these items kind of fit within those 3 of those domains I mentioned, as well as screening. So yep, so if you want, you can rate your school in those areas, and then I'll let you know what those overall categories kind of look like. Next slide. And these items are related kind of around our tier 1, right? Are we investing time and resources into building positive relationships with caregivers, right? These are those things that are good for all caregivers. That's a strategy that is useful for everyone, caregivers, adults, children. All of us would love to be in relationships with people where we feel like we can have a positive communication going on. Are we establishing and maintaining bidirectional communication with caregivers so that it's not always one-sided, but that we're really having some back and forth? And is this communication proactive and positive? Or are we only reaching out when a kiddo is in trouble or there's an issue to be solved, which can make it, awkward and unpleasant to always engage in negative conversations around your school or your child. So this idea of reinforcing that we are proactively and positively engaging with our caregivers in our community and being culturally responsive. Are we using approaches that align with the values of our caregivers? And that can be important to make sure we're on the same page as to what are the expectations around engagement. And are we using do we mean the same thing when we're using that word? Oftentimes, some of the literature around family engagement comes from the school perspective, right? So that might be their definition around what that looks like, how that's best to be done. Usually it involves things like showing up to home and to school conferences, or volunteering for trips, or in the room. So you're in the building. Whereas sometimes caregivers can see it as, do I get my kid ready to go to school? Are they fed? Are they clothed? Are they ready to pay attention? Did I get them there on time? Are they at the bus stop? So we can be using the same terminology to talk about very different types of activities. So it can be really helpful to have those clear conversations up front as to what we mean by engagement and what engagement looks like for our school, which can be very different from the school down the street, and that's fine as well. All right, next slide. So these are some strategies that might fit well into that tier 2 and that tier 3 level. So this is when we're up in our support, where the groups might get a little smaller. A student might be participating in a grief group or a social skills group or something along those lines with other students who might be having reporting similar concerns. In our tier 3, again, are those individualized interventions for when kiddos are experiencing probably a high level of distress and maybe some significant impairment. But caregivers can still be really involved here in how we go about designing those interventions and supporting our students. So this can be helping to evaluate the fit of interventions. So involving caregivers to evaluate the fit of interventions with respect to strengths, needs, cultural and linguistic considerations of students, families, and communities. Caregivers are likely experts in what's available around them, what the local culture is like. So they might be able to provide some information on whether or not the interventions we're choosing are going to be of interest to our students and our families, because we can have lots of great interventions in our building, but if they are not appreciated or recognized or seen as valid and reliable for the community, then they'll just be a really nice intervention that won't get used. So being able to engage students and families in that work can be really helpful in not only choosing interventions that are evidence informed and have support around them, but that the community is really excited about and willing to use. We can also think about building consistency between our home and school environments by sharing and receiving information from caregivers that encourage that consistency. Inviting caregivers to trainings and events related to mental health, behavior, and well-being. Seeking and incorporating caregiver input about mental health trainings for staff, caregivers, and students. We can also reach out to caregivers to see if they have expertise and want to contribute and co-lead some of the trainings with us. Next slide. And these final ones kind of align with those impacts. So the documentation of what we're doing, how is our system being used, how are we sharing that information back with students, caregivers, and our larger community, and how are we funding and sustaining our programs. So how often does my school share data with families related to student use of mental health services? Are we being open and transparent about how our system is being used? How often does my school involve caregivers in the dissemination of mental health information to youth and to families? As Dana mentioned, the huge role that those family support specialists can have in being able to reach out and create relationships with other parents can be really helpful. How often does my school partner with families to review data on school mental health system outcomes to inform ongoing mental health programming? So are we sharing what's working and what's not working, and are we willing and able to pivot when things are not working? How often does my school partner with families to plan fundraising events that support school mental health programming? Engage caregivers to collaborate on pursuing and securing funding, and partner with families to prioritize how best to use funding for school mental health services and support. So again, these are some additional ways that caregivers can be involved and contribute to a comprehensive school mental health system. And we know it can be tricky too, right? Of how to invite folks in at the tier 3 level. There's making sure that we're being sensitive to privacy concerns and keeping people's information private, who are involved in using services within our comprehensive school mental health programs. But I hope what these items highlight is that there are several different ways that caregivers can still be full participants in our comprehensive school mental health systems outside of kind of that direct intervention at a tier 3, right? We can seek out their opinions on our screening process. We can share our information and hear their opinions back on what that means or what we should do next. They can help us figure out how we might do our fundraising and use the money we have. So there are lots of different ways that caregivers can be involved in our school mental health system to really help support those outcomes and create a high quality school mental health system for students and families. All right, next slide. So if you were going along with me, that's our first domain. So you can calculate your score. You can add it up and divide it, I believe, by 20. All right, next slide. Okay. So what we learned when we reached out to caregivers about what activities they would want to participate in, if they were going to be involved in comprehensive school mental health systems. And a lot of the responses that we got back were what the school could do to improve mental health services for students, which is different than what is usually included on a family engagement measure. It's usually just on how are we outreaching to caregivers, whereas the caregivers that participated in our survey really highlighted the importance of wanting to know how schools were providing training for students and staff, sharing information related to processes. So there's this added domain of not only thinking about how are we reaching out and engaging parents and caregivers, but also how are we taking care of and what are we inviting caregivers into? What does our system look like? Or do we have trainings? Are we engaging students in our mental health system? So there was this kind of unique ad to have not only schools rate their engagement strategies, but also to take a look at what does the system look like that we're inviting caregivers into, and is there room for improvement there as well? So this additional domain looks at just that. What is the quality of the training and how often are we providing mental health supports to students? So how often does my school provide trainings to on student mental health to school staff, including knowledge about signs and symptoms of child psychopathology, support strategies, promoting positive mental health, and culturally responsive strategies for diverse families. They also highlighted the importance of providing trainings to caregivers on youth mental health and related topics, and students. Is schools taking on the responsibility of helping students support other students around mental health? In addition to, are we sharing or providing information about available school mental health supports and referral processes to students and families? And are we implementing evidence-based interventions in the schools? So again, you can rate those on a 1 to 6 scale of how frequently do you think your school is engaging in some of these practices and providing training and sharing information. And again, these kind of map on to some of our teaming domains and really focus on some of those support strategies that are just as important as our services, like training. On the next slide, these are some of our tier one kind of things. So how often does my school incorporate social emotional learning into daily school activities? Sponsor mental health and wellness events for students, like mental health fairs, book fairs on youth mental health. Are they checking in with students on their well-being? And these are, again, just going down our tiers, our tier 2 and our tier 3 aligned activities. Does the school have mental health professionals? Are those mental health professionals in regular contact with caregivers regarding the services and supports for their students? Are mental health professionals seeking the input of caregivers about their child's strengths, challenges, and what strategies work best for the student and the family? Are our interventions culturally responsive? And are we using accommodations to successfully support student mental health strengths and needs? This final group really maps on again to those impact and funding domains and really looks to see how often schools are monitoring how well staff and teachers are implementing the programs and share information with caregivers. Are we monitoring outcomes? Are we looking into and keeping track of how students are responding to programming and share that information with caregivers? Are we communicating with transparency in this evaluation procedures and interpretations of any assessment data about student mental health? Are we collaborating with community organizations and partners to host fundraising events that support school and community mental health programming? And are we securing funding and developing community partnerships to ensure adequate mental health support coverage? All right, so you can add up your second one and divide it by 19. And on the next slide, it will what schools will get after they complete their assessment is they'll get a report that will summarize the information they put in, and then it will help them kind of chunk their scores into these three kind of categories. Emerging are those areas where we are, just starting out. We might not have had lots of opportunities to engage in some of those practices. Progressing are those things where we're doing them some of the time. If we ask staff or families about them, they may know what we're talking about. They may not know what we're talking about. So those things that are kind of in practice, but not necessarily standard and are established, those are the things that are happening almost always to all of the time. These are the strategies that we feel really confident about, that if our families were asked or our school staff were asked, people would really know what we are talking about. You could probably like feel it in the school environment, right? So if you looked at some of your scores, you can think about, do those scores kind of match my expectations of my interactions with my school? And what we're also hoping for is that on our next page, that the reports can provide next steps and opportunities for continuous quality improvement. So that is a big thing of ours at the National Center, is that we are always thinking about and working with schools and districts around how do we make things better? How can we push things forward? How can we make sure that we have high quality school mental health systems for our students and families? So they will, also part of the report will really focus on that. Like, how do we turn that information we just got into a really good action plan? And because there are those two domains, there's some opportunity to choose where we want to focus. We can either think about how we are creating space for families in our policies and procedures. So how are families being, how are we creating partnerships with our families? What frameworks are we using? Are we building those relationships? Are we doing that outreach? Do families feel supported and welcome in our school community? Is there some really good school and home consistency? We can also think about how inviting is the environment that we're asking them to join, right? So schools can also do some self-reflection. So are we asking parents to come in and, like Michelle was saying, come down to our basement and walk around in our dark space, and then we're wondering why caregivers don't want to come in or why they don't want to participate. Some of that matters, right? How it feels to walk into a space. So it can be important to not only think about, to take stock of how we are outreaching to folks, but also how we are inviting, what the environment looks like that we're inviting folks into. And we are hoping to add a functionality onto our SHAPE system that will allow this assessment measure to be distributed to caregivers as well. So school teams can hop on SHAPE, fill it out from their perspective, but then they'll also have a link available that they're able to share with caregivers so that they can get caregiver perspectives on how family engagement is going too. Next slide. And again, we want this to be useful not only for schools, but also for caregivers so that folks can get ideas on how they might want to be involved in school mental health. Do you want to participate on teams? Do you want to share your expertise in lead trainings? Do you want to just help? Do you want to support fundraising or review screeners? We hope that the measure gives enough examples and different ways to be involved that it can not only help schools engage in continuous quality improvement, but also provide strategies for caregivers on how they might want to be involved in their school community. You can always, if you're looking for different ways to stay involved or want more information on family engagement, school, district, state education websites are always nice places to start. Lots of schools and districts have identified visions and goals around family engagement. That can be a good place to start to get an understanding of, what schools think are important. And so you can see how that aligns with your perspective as well and what work they are committed to working on. There's also, like the parent said in Dana's quote, that there's always tons of sites where you can get additional information from, such as the, CDC has additional websites. Here are some resources right from Pennsylvania has some state education websites around to support families around mental health. And one more I want to pop in here is an example of like Maryland's shared framework of something I pulled off the education website just to give you an example of what might be available in on your website. So those are good places to look into. There is some federal money that has gone out and to support ongoing stuff around family engagement with statewide family engagement centers. There's the organization you're a part of. There's lots of national organizations as well. So there's tons of different ways to get additional information on family engagement and specific information related to your school or district. And I will share it to Jessica so she can go through some additional resources from MHTCC.
Thank you so much, Sam. Hi, everyone. Jessica Gonzalez here. I'm the Associate Director and lead of our School Mental Health Initiative here at the Mental Health Technology Transfer Center Network, also known as the MHTTC Network. So for those of you who have not worked with our network just yet, we develop and disseminate resources, provide training and technical assistance, and deliver workforce development opportunities for the mental health and school mental health workforce. Our network was established in 2018, so about 5 years ago, and is also funded by the Substance Abuse and Mental Health Services Administration, known as SAMHSA. We have 10 regional centers. You'll see those on our map here on the slide. So 10 centers that are spread out across the United States. We also have 2 national focus area centers, one center that focuses on American Indian and Alaska Native populations, and a center that focuses on Hispanic and Latino populations. We also have a network coordinating office. And so you'll see that pointed out in orange on the map there. And that's where I come from, a Stanford University School of Medicine. And we serve as the focal point and provide leadership and infrastructure and support to the 12 centers that make up our network. And so again, our network really focuses on accelerating the adoption and implementation of mental health related evidence-based practices. And so the way that we do that, like I mentioned, is we develop and disseminate resources. We provide training and technical assistance to the mental health and school mental health workforce across many different topics. If we go to our next slide, I'll share a little bit about some specific funding that we have received for the last 5 years to focus on development of training and resources and technical assistance for school mental health. And so through our school mental health initiative, our goals are to bring awareness to student mental health and evidence-based school mental health supports and services. We disseminate information and provide technical assistance and training on the implementation of mental health services in schools and school systems. And so here on this slide, you'll see just a variety of examples of some of the regional and population-specific training and technical assistance that has been provided through our school mental health initiative, through the 12 different centers that make up our network. And so, really, we are so thankful to receive this funding from SAMHSA. We have just been awarded an additional year of funding. So we'll be starting our 6th year of our school mental health initiative. And this funding really supports us in developing training and technical assistance for the school mental health workforce to address some of the needs in school-age children and adolescents that continue to become apparent and a priority in our country. So our network really in the last 5 years has been responding to many different mental health needs that we've heard are important and a priority through different stakeholders across the country. So we listen to feedback from schools, school districts, state departments of education, educators, school mental health professionals, families, and we try to address those needs by providing different technical assistance opportunities and resources, all free of cost, to the school mental health workforce. And so some of the key issues that we've been focusing on lately, based on some of that feedback that we hear from our stakeholders, some of those key issues include suicide prevention, mental health disparities, the impacts of school violence and racial violence on students, educator wellness, the retention and recruitment of school mental health professionals. We've been seeing a lot of staff shortages in schools lately. And so those are just some of the topics that we've been focusing on as of late. But again, we try to be attentive to the needs of our stakeholders, to the needs of those who play a role to support student mental health in schools and outside of schools, and try to respond in a timely manner by developing several different trainings and resources. And so some of the modalities that we consider in the trainings that we develop, so we do webinars, learning communities, learning collaboratives, online courses. We now have started again face-to-face trainings and conferences. We also develop products including fact sheets, curricula, podcasts, and many other tools really to support the school mental health workforce in implementing mental health evidence-based practices in schools and school systems. And so I won't go more in depth about our school mental health initiative because of the time we have remaining in our learning session here today, but I'll add a link in the chat box to where you can find more information about our school mental health initiative and the services that we provide. So I really am happy that I kind of get to wrap us out here by sharing with you some of the many resources that we have available through our network to support you all in continuing to engage families in the work that you all are doing. And if you are, a caregiver in the audience here today, you can learn a little bit more about the resources that we develop for the school mental health workforce, for educators, to continue to support them in understanding the important role that families play in supporting student mental health, and how schools really need to prioritize engaging families in their work. And so I want to start off by sharing an example of a training that we developed at the MHTTC network to assist educators and school staff in understanding the role that they play in supporting the mental health of students, and the importance of creating a safe and supportive school and classroom environment for all students, which, as you know from the presentations that Dana and Lachelle and Sam have provided earlier, are really key in supporting student mental health. So on the screen here, you'll see that we're highlighting our training package, Classroom WISE, and WISE stands for Wellbeing Information and Strategies for Educators. So this training package was developed by the MHTTC network in partnership with the National Center for School Mental Health, and it offers evidence-based strategies and skills for educators and school staff to engage and support students who are experiencing adversity and distress. And so this package includes a free online course on mental health literacy that is aimed for educators and school staff. We also have a video library and resource collection, and all of this is available on a user-friendly website, classroomwise.org. And I've entered the link to that website in the chat box in case you all are interested in just taking a quick look. But I want to just make sure that I mention that, when we were developing this training, what we did was we conducted focus groups with educators from across the country over the span of 6 months. We met with teachers from different grade levels, different ethnic backgrounds, different years of experience. We also held one-on-one interviews with mental health and education leaders from different places across the country. And from those conversations, what became very clear was that teachers understand that they're critical in supporting student well-being, and they want to support the mental health of their students, but they need additional training to do so. And this is something that Dana touched on earlier, where she mentioned her experience as an educator. And she said, that she felt often that she wanted to support her students who may have been struggling with mental health concerns in her classroom, but didn't know how. And so we used the information and the feedback that we gathered from educators and from school mental health leaders across the country to develop this training package, and really try to support educators in having a better understanding of how to identify students who may be struggling in the classroom and what to do to create a safe and supportive environment to become individuals who students can really go to and share when they're experiencing adversity or distress. And so again, this is a 3-part training package that includes an online course. It's self-paced. It includes evidence-based strategies to promote student mental health and support students with mental health challenges. And all of the skills that we have embedded into this training are based on scientific literature on school climate, mental health literacy, social emotional learning, etc. And so some of the topics you'll see here on the slide, some of the topics that we really focus our modules on in the course are creating safe and supportive classrooms, teaching educators how to reduce that mental health stigma that continues to exist, the impact of trauma and adversity on learning behavior. So wanting to understand, students who may be struggling in the classroom and how their mental health really impacts their behavior and their academic achievement. Also helping educators better understand how they can support students in their classroom by utilizing those evidence-based practices and strategies. Several states have incorporated this online course training into some required professional development for school staff, which is amazing. And we also have educators who just on their own say, you know what, I want to learn more about this topic. I want to be able to engage with my students and be a trusting person to them. I want to learn how to engage more with families and ensure that they are, in the know about their child's mental health. And so we've had over 15,000 people who have completed the online course since we launched it 2 years ago. And so again, we've learned a lot about how schools are using and implementing this training and have developed implementation resources to support the use of this training. And so I'm going to link you all to those implementation resources that are available on the ClassroomWise website. But this is just one of many resources that we have developed through the MHTTC network. And I know I don't have time to go into some of the resources that I was going to highlight today.
Jessica, I need to stop you there only because we have just a couple minutes, and I do apologize. We went over some of our presentations, but we need to get at least one or two questions resolved. And we're going to share, our follow-up is we share all information and resources that you have.
Wonderful.
So thank you.
Thank you. Thank
Jessica,
you
just have so many resources, and the entire presentation today has been just incredible and jam-packed with resources. So everyone, like Lachelle said, don't worry. We are going to be sending you that along with the toolkit as soon as we can get it out within 7 days. You will get that. Thank you, Jessica. We have 4 questions that I think we can get to. And actually, it turns out it could be one from each person. Really quickly, Jessica, Anna had asked, do you have any in-person technical assistance or resources available in LA County?
Yes, so I would suggest that you go to our MHTTC website. We have a page on our website that allows you to find the center that serves your region. And so you're in LA County, that would be our Pacific Southwest MHTTC. They definitely are, in the swing of in-person trainings now. We still offer virtual trainings as well. And so I suggest that you go to the website, find the Pacific Southwest MHTTC, and I can link you to that page in a minute here in the chat box. And you'll see that they have a ton of trainings and resources available to you free of cost.
Thank you. Lachelle, there was a question about what was the difference way back when you were speaking. What's the difference between peer support and family peer support, especially when it has to do with the school system?
So with family peer support, it is a caregiver or a parent or a caregiver that has lived experience. So meaning I actually, with my son, was, I walked through those systems with him. I advocated for him. I was at the IEP meeting. So I have lived experience with that. And with peer support is a peer who is supporting parents and families through different situations. In the school system, it may just be a person who supports the family when they go to meetings, but they don't have the lived experience.
Right. And peer support in general is family peer specialist. If you hear those words, or family peer, you know that that family member who is delivering the services is the primary caregiver who have walked the walk supporting their child. Peer support also is like youth peer support or adult peer support. They themselves may have experienced a mental health or a substance use issue or have a diagnosis, and they're helping others at the same level, that they are helping individuals who are experiencing mental health, behavioral health, or substance use issues. So it's sort of a different level. Samantha, there was one last question here that asked, where would you get a copy of your test that you gave out? I guess there were several people asking.
So our goal is in development right now. So it's being put on our shape system. So I'll drop the websites in the chat box. But our hope is that in the next couple of months, it will be up and available on Shape so that there can be online input and you won't have to keep track of any papers. But I'll also, all of the items that will be on the measure are in the slide deck that you'll get as well.
Thank you, Sam. And lastly, Dana, if you have one piece of information you can give to a fellow teacher, even though you're not a teacher at the moment, what would you give them?
I would say give yourself a lot of compassion and take care of your own self-care so you're available to show up for your students as well as you can, but also take advantage of some of the really amazing resources that MHTTC, National School Mental Health, Center for School Mental Health, and NFF have. NAVSTAC as well. We all have great resources to help build your toolkit up because there's so much great free information out there for teachers about how to support students' mental health. And the more you know, the more you can support them.
Well, thank you, all of you. I hope this was an informative and eventful, helpful event. And it's getting late in the day, so I think I'm tongue-tied. I want to thank Lachelle, Dana, Samantha, and Jessica again for today, and thank everyone for your participation. As always, a special thanks to Dr. Linda Goggin, NAVSTAC Principal Investigator, and the NAVSTAC team for helping us run today's event smoothly. Thank you. A shout out to Gina. We are delighted that you joined us for our new season of our webinars. We hope to see everyone in Chicago in November for our conference, and of course our pre-conference that is free training held on the Wednesday before the conference begins. Please remember to register for the pre-conference since seats are limited. Also, remember to fill out your survey. As you exit this webinar, you'll be taken to the survey. When you finish the survey, just like you were taken to the survey, you will be taken to your participation certificate. So you leave here, you will go to the survey, fill it out, and then it'll take you automatically to get your certificate. If it doesn't work, feel free to email us. I will keep this Zoom on for 5 minutes because if I shut the Zoom off, you won't be taken to the survey. So if you can exit on your own to get to the survey, it's the best way to do it. Again, thank you all. It was great. Love seeing all these familiar faces and some new faces. Bye-bye. At 3:35 Eastern Time, I will shut the Zoom off. If you could exit on your own so you could be taken to the survey, that would be appreciated.
Sorry, I'm trying to copy and paste and it's not wanting to copy and paste for me.
A follow-up email.
Michelle, are you on? Do you think you can post on the chat where the Zoom exit is? The Zoom link is?
I don't know if she's trying to get the Zoom link or she's trying to copy the resources. Or are you trying to copy the resources?
Oh, Dana has it. If you grab that and just copy and paste it, you'll be taken to the survey. Resources will be sent to you. Don't worry about them. You will get them. I will be turning the Zoom off and exiting Zoom at 3:35. You have 2 minutes. And I thank you all for entering and leaving on your own and taking the survey. That's greatly appreciated. We will be closing the Zoom in 60 seconds. If you could exit on your own and fill out the survey, we would really appreciate it. Thank you for helping.